this clarification, Chairman and members of the committee, that there is a disconnect here. The honorable member is asking about a clinical assessment. He's asking about Kemsa assessing to the customers. I would wish to say this and to be gotten from my context and the way I perceived this issue during that emergency preparedness. One, all emergencies are supposed to be carried and are taken by the national government. They are not supposed to be institutionalized. The institution here being Kemsa was communicated to be prepared as the procuring entity of the national government. Our issue of preparedness was guided by the modeling that was done by the Minister of Health. And the question maybe you should be asking them is the models that they did up to date. In the month before April, we were communicated that by end of April, we'll have more than 10,000 COVID cases. What would that mean? You go back.
I want us to be clear on one thing.
I wanted just to make that clear.
I understand, yeah. But I want us to be very clear on one thing. All these figures and issues that you're talking about, none of it so far has been substantiated. Because as far as we have been able to ask, the management who are currently sitting as management, when they were asked these questions, they said they're not aware of anything that had actually been written from the ministry. You are you're currently the suspended CEO, so we are hoping it's not an issue of just institutional memory, but whatever it is that you're saying will be substantiated as well.
The issue of the modeling?
The issue of the modeling and the issue of all these figures as to
the letters of 758 and the 1.1 billion.
The 758, it has already been presented here to us, and we'll get to the issue of the 758.
Yes.
What the honourable member is asking, and let me now put it very clear to you.
Yeah.
What the member is asking is, you bought items without realizing that these items are going to be in your warehouses and your stocks. Secondly, in your own, this is not the first time you are appearing before PIC. In the previous years, yourself and even your predecessor, when they appeared before PIC, one of the queries that was there was that you had about 100 and something million worth of drugs that had ended up not being utilized. And the answer that you gave us at that time was that the module then was that ministry was asking you to buy, then you push it to the districts then, district hospitals. Now the module changed, where now it is a pull system. And those are the words that you used in yourself. So what changed?
Allow me, Chair, to say the following. I've just told you about maintenance and sustenance of the strategic reserve of the essential medicine and medical supplies. That is one of our manner of discharging our functions. When you look at that, the 10,000 cases that were pronounced that will be there by end of April, what does that translate to? It translates to the risk to the healthcare workers. It translates to the risk of the people who are the frontline workers. When you look back, you have Kemsa faced quite a lot of challenges. One of the challenges was the fact that during the State of the Nation address in April, Kemsa Act was said to be suspended for 3 months. And counties were given 5 billion to procure from the local market for the local PPEs and face masks. But there are some other commodities that are not necessarily...
So this is going to be my last comment before I allow my colleagues. But kindly, I would urge you, for purposes of anything else, do not try and because, as I said, facts and figures don't lie.
Yes, and
by the time of the State of the Nation address,
yes,
you already had up to 5 billion in your stocks.
It was not 5 billion because we started receiving the commodities.
And as I said,
yes,
facts and figures do not lie.
Yes, sir.
These figures, by the time of the State of the Nation address, one of the things that actually triggered was because counties felt that they were going to be able to purchase these things at a lower price. It beat the whole purpose as to why we have a single agency to be able to buy in bulk. So kindly, do not try and circumvent and go and take us around in circles. You were simply asked, and in your answer you've said there's a letter where you were given instructions to prepare for 10,000 cases. So that is the letter that we want in front of this committee. We want to know who wrote that letter, where those assessments came from.